Here on a medical mission, and our focus was sickle cell. We wanted to educate and medicate. We want to teach people, and we wanted to educate and medicate. Our focus is sickle cell. We wanted to teach the people of sickle cell how you get sickle cell, what the process of sickle cell is, and the medications that they need to help survive. The sickle cell is a lifetime disease unless you get a bone marrow transplant. The stressors that we have coming here is customs, getting things through customs. We do the proper channels every time, and customs always wants money from us. They want to tax us. We are registered through the Ministry of Health, and we also go through poison control to make sure all of our medications are not expired, they're not open, they are from a pharmaceutical company that has a stamp on pharmaceutical company. And every time we go to customs, they stop us and they want us, they stress us because we know we have to catch another flight to get into the county, and they want to stress us and get money from us. They want us to miss our flight, or they'll stress us to the point where we don't care if we miss our flight. That's why we pay the money. We have qualified doctors and nurses specialized in sickle cell to educate and medicate. When you come to the clinic, you will get registered, we will take your vital signs, and you will be seen by a doctor. Once you are seen by a doctor, they will prescribe the medications, and then you will be educated by our master educator, Keisha, in sickle cell. Everything you need to know about sickle cell. How to handle it yourself, how to treat somebody else, how to take care of somebody else, a loved one, a child, older adult, how to take care of them if they have sickle cell. The challenges that we've noticed that the Kenyan people have had is it is very hard to get health care and to get medication. And sickle cell is a medication. You need medication every day. It's a lifetime disease. So the challenges that are faced in Kenya are they don't have the resources here to give the medications. They go to the doctor, they don't have the medications for the patients. That is the biggest challenge that they have as sickle cell patients. Yes, we come back every 2 years. Journeys by Grace Global Mission. We come back every 2 years into Kehancha to educate and medicate. We bring our team of doctors and nurses, our educators, and we provide clinics to give you guys the services that you guys deserve, medication and education.
My name is Keisha Hampton, and I'm the VP of Journeys by Grace Missions. I have been with Journeys by Grace since the beginning, and we have continued to face many challenges related to trying to bring needed medications to those suffering from sickle cell disease. One of the challenges is getting approval to bring over the needed medications like pain medications, hydroxyurea, Paladrone for the anti-malaria medication, as well as folic acid. When we do finally get the medications in, and some of the medications in, we still face challenges with getting the people to understand what sickle cell is, and to understand that this is an inherited condition from the mother and father, and it's not the Illuminati. We face challenges when it comes to the families that we see having access to medications or having access to the real medications. People with sickle cell have a inherited blood condition, and one challenge that we face is helping the people understand that having sickle cell, their child having sickle cell, is no fault of theirs. It's not something that they've done against God. It's not Illuminati. It's inherited. And breaking that barrier is ground one. Round two is breaking the barrier of them not having access to care. Universal health care, or health care for people with sickle cell disease or other inherited or other chronic diseases. Yes, the number of people is quite overwhelming that have sickle cell. There are millions affected here in Africa alone, and over thousands affected in Kenya with the SS sickle cell disease. And the barrier to accurate treatment is there. There aren't providers who understand what sickle cell disease is, and if there are, they're really far. The parents can't get there. And then the barriers to the medication, the hydroxyurea that's needed to keep a person healthy, to keep a person from possibly having strokes at the age of 3 and the age of 4. The access to folic acid, access to penicillin VK, access to other medications like Endari. that's our goal. We come here with a goal to save lives, to educate people, to greet people and let them know that even though you may not be receiving all the help that you need here, we're coming to bring that help to you. So we continuously come every 2 years. We will be back in another 2 years. And every time we come, we make it bigger. We try to bring more. We try to support the people. And we try to give them hope that there is light at the end of the tunnel, that their child could possibly have more access and end up, being able to live a successful life and get to adulthood. Here in Africa, most of the children with sickle cell disease die before the age of 5.